Good afternoon, and thank you all for coming today. Thank you for taking time out of your busy schedule to spend time with my 3 West nurses. Today, we'd like to discuss to you our strategic goal for changing the process of bedside nursing. In the past, the bedside nursing would give report after getting the SBAP report, give report to the nurse, and the ongoing nurse would go into the room and see the patient. The off-going nurse would go home. Recently, after my shared governance staff members reviewed the HCAHPS scores and the nursing sensitive indicators, we saw deficits with patients dissatisfied with their care regarding feeling that the nurse didn't care about them. We also saw the dissatisfaction with nurses with their job, feeling that the nurses weren't accountable from shift to shift. And a lot of overtime, a lot of long reports, very extended, and not really getting to the point of the plan of care for the patients. So the nurses worked on it, the nursing sensitive indicators and the HCAHPS scores, found all the deficits, the barriers. We did all the evidence-based practice, the researches, and we were able to sit and develop what was called a face-to-face bedside report, which took a nurse usually anywhere from 3 to 5 minutes. We were able to discuss patient's information. You're able to identify the patient. There's accountability from nurse to nurse. Ongoing shift is able to ask questions, communicate with the off-going staff in front of the patient, include the patient in the plan of care as well. Implementing this new process would not cost the hospital any money. There is no financial responsibility other than accountability and support and encouragement to the nursing staff. With implementing face-to-face bedside report, the off-going nurse would communicate and make sure their patient was medicated, comfortable, so that when the ongoing nurse comes on, they're able to get report, go over the indicators that would put a patient at risk for either infection, complications, and things like that. Example is an SBAP, which is a patient's report that gets printed out to the nurses that gives all the patient information, actually has the score that a patient would score, either high or low risk for any type of a DVT prophylactic, a need for that, that would indicate a patient at high risk for possibly getting a complication blood clot. Second of all, it would indicate the date and time that the patients had the Foley catheter in, because they can get a UTI, which again is no longer reimbursed by hospitals. So if we can decrease those numbers of any hospital-acquired infections, then we would increase the reimbursement, which would help the hospital out financially. So when the nurse goes into report with when the off-going nurse goes into report with the ongoing nurse, there's accountability as far as there's a good IV site, there is a patient identification band on, there is any indicators as far as a patient being at risk for any kind of infections or problems that is communicated with the patient along with the plan of care. Now, implementing this process, we will discuss with the physicians as well that this new process is going to make the nurse's communication more effective with the physician and also with the patient and the charge nurse as well, so that it's not always the charge nurse that has all the information, but the bedside nurse got an accurate report. The responsibility as far as the administration is to communicate the importance of this as far as communicating, supporting the staff, being able to be hands-on for the staff. The nurse manager would work around at the same time the nurses are doing shift change and communicate her support and encouragement to the bedside report. Second of all, we do have YouTube handouts that actually give you a visual demonstration on the process, being able to do a head-to-toe communication with your patient and discuss the plan of care within a 5-minute period. So our nursing staff is 4-to-1 staffing, which would mean the shift change 30 minutes that you have should be adequate enough time for you to communicate between your 4 patients effectively and be able to reduce your incremental overtime, which sometimes is just 15 minutes, but 15 minutes between 80 employees over a 2-week period does add up. Second of all, the nurses are more satisfied because they're not walking into bad IVs, they're not walking into wrong information, wrong IV fluids. So the accountability from shift to shift and staff to staff also increases nurse satisfaction with their job. Now, being able to identify any risk factors or being able to be proactive with making sure patients have their catheters out, or we know how long their IVs have been in, or we are able to communicate any kind of risk behavior with the ongoing nurse, that will help reduce any kind of future complications for these patients. So what I would like to do is I'd like to implement this process in a timely manner, and I'd like to be able to hand out information to my staff, communicate through staff meeting. I would like to be able to, I will survey them within about a month of implementing this process to find out if the nurse feels that she's more satisfied with her job, that there's more accountability from shift to shift. I'd like to check if the patients feel that they're safer. We will be able to measure these by the HCAHPS scores and also the nursing sensitive indicators. We will be able to check for infection rates, that they've gone down and they've reduced. Also that there is increase in patient satisfaction, as well as the nurses are satisfied with their jobs. Those would be measurable indicators that this process of implementing face-to-face bedside nursing is successful. So thank you again for your time. I appreciate all the effort that you make every single day, and we would just like to thank you for supporting us to improve patients' quality of life. And that's it. Have a nice day. Thank you.